Hello viewers, myself Dr. Vishal Chafle. I am consultant and interventional neurologist practicing in Apollo Hospitals, Navi, Mumbai. Today I will give brief information on endovascular treatment of aneurysms and AV malformations. Aneurysms are abnormal vascular dilatation and which rupture and cause condition called as subarachnoid hemorrhage, which is a type of hemorrhagic stroke and it can be life-threatening, and once ruptured, these aneurysms have tendency of re-rupture which can be life-threatening. So these need treatment. Endovascularly, they can be treated by means of coiling. Coiling is a procedure where we enter the arteries to the groin or the radial artery. This procedure is done under general anesthesia. Once we reach the artery, we take our microcatheter and our microwire and we position our microcatheter into the aneurysm sac, and slowly with putting with multiple coils, we'll obliterate that sac and we exclude that aneurysm from the circulation. This is called as simple coiling. Most of the aneurysms, especially they are narrow neck, they can be treated by simple coiling, which is a simple procedure. But sometimes the neck can be wide and then we have to take the help of balloon and sometimes with the stents. But there are certain aneurysms where there is an abnormal vascular dilatation itself. We call it fusiform aneurysm or dissecting aneurysm, where coiling is not possible. Sometimes surgery is also not possible because of the only treatment is a parent vessel occlusion. But nowadays we have special stents called as flow diverter stent, which can be used, and without sacrificing the artery, we can treat that aneurysm and that vessel wall become normal over the period of time. Here we put a flow diverter, which is a special stent which exclude the circulation, the sac of the aneurysm, and it obliterate the aneurysm sac over the period of time, and it become part of the arteries. The small arteries or arterioles or branches of the artery which arises from that segment, they remain patent. That is the specialty of this stent. So these are the stents. Only thing is we have to continue the blood thinner for some time in such patients. Nowadays we have different devices also, and we are using it for treatment of various aneurysm, especially the bifurcation aneurysm. We have wave device, we have control device. So aneurysm treatment is day by day getting simple and possible by different new techniques, and we can treat virtually all aneurysm by endovascular means. Now coming to the AV malformation treatment by endovascular means. AV malformation are abnormal vascular connections between arteries and veins. Most of them are developmental, and over the period of time they grow, and sometimes they develop weak spot and they bleed. Normally, once they bleed, then only we treat them. Otherwise, asymptomatic we can observe also. So there are different ways to treat it: by endovascular embolization, if possible by surgical excision, and sometimes reduced surgery. So endovascularly they can be treated. We first do diagnostic angiogram. We study the angio architecture, feeders, then any weak spot, then venous drainage of such type of AVMs. Then again the procedure is done under general anesthesia. We take our catheter either to groin root or to the radial artery. We take our catheter in the desired artery, and we again position our different microcatheters. These are very thin catheters with micro wires. We position into the AVM nidus as distally as possible, and slowly we inject the embolizing material. Different type of material available. We have onyx, tweed, then hill, and sometimes we have to use glue also. And slowly we inject and we fill that whole nidus and also the draining vein with the embolizing material. Sometimes we have to use multiple settings, especially there are multiple feeders, or sometimes we have to use multiple catheters in the same city. And this is how we treat AV malformations.